Hello, friends. This side, Dr. Simran. I am Dr. Simranjeet Kaur, and I have been running this Sukhija Physiotherapy Clinic from 10 years. And these days, as the season of COVID is going on, so I am getting a lot of requests to teach the exercises and what is COVID. Many doubts where people are asking when to wear mask, when not to wear mask, should we do mask wearing while exercise, and so many lot of stuff. So I thought of to engage myself with you all and to teach you all about COVID. And in case if I could be able to clear up your doubts, it will be a pleasure for me. So today in this webinar, I'll be dealing with what is COVID, what is the pathology of COVID, how does it spread, other questions like how it came into being and why are we affected and what are the precautions we need to take care to get rid of this, and in case already if we are affected, then how long we are safe, can we go outside or not, and if in OPD, what exercises we should do and what precautions we should take, and if in ICU, what happens with us if we are in ICU. These kind of fears, I'll clear it and try to motivate you all to be in this era with a positive thinking and a positive motivation. Okay, because if we are thinking negative, then the diseases attract us, and if we are positive, we do exercise daily, we feel good about ourselves, then first of all the disease doesn't attract us. Secondly, if it happens also, we are able to get rid of it. Okay, and don't you worry about it, because the if already people are getting affected, and there are already many of them who have been treated and got cured as well. Okay, and don't involve yourself too much into the news of coronavirus, otherwise you'll be so negative that you will not be able to focus on any other thing. So I'm just going to start about coronavirus. The first question I was acquainted with was, what is covid COVID-19? So COVID-19 is basically a virus. Okay, and it has been there from centuries into this world, but what happens is it goes into mutations. It's a very small virus and mutates, so we are not able to judge what is happening to it. The actual name of COVID virus is severe acute respiratory syndrome coronavirus 2, and it is also said to be COVID-19 because it is of 2019 origin. So we gave the name of COVID-19. It is a very contagious disease. Contagious in the sense that one is giving spread to the others in not a simple one, like one is not giving contagious infection to one person, but it is having a exponential growth. How an exponential growth? Like if one person is affected, it can affect three others nearby, and those three can go into another three and giving 9, then 27, like that. So it is giving you very fast growth. Okay, so we can protect ourselves definitely by taking the precautions, especially of mask and hand sanitization. These are the two things you should carry with you all the time. Wherever you are traveling or even at home, you should keep one hand sanitizer and a mask along with you, in case even if you have anybody coming up, a guest coming up at home or something, you should not remove your mask in front of anyone, because anyone could be a carrier. It doesn't mean that always the affected person will have the symptoms like cough, cold, or any flu or fever will be there. It doesn't mean that. Sometimes people are just having a disease as a carrier. They are not producing any symptoms because their immunity is strong, or some other reason they are not getting symptoms, but they might be carriers. So you should take care of the precautions with each and everyone nearby. And whenever you are sitting alone, like if in a car you are alone, or if you are in the bedroom you're sitting alone, and that point of time, or you are with very close person who you cannot avoid, with like small babies there or something, then you can if in the same family you are in the same environments all the time, only then you can just remove your mask for some time. And or but if in case if the person is from outside, you should wear mask and should sanitize your hands every now and then. after doing any work, because if this breath, but it also is from the surfaces in touch. Like if somebody has a cuff in front of a wooden surface, or in front of a doorknob, he has touched his hand, and on the doorknob he has put, so that doorknob, if you are using that same doorknob, and then if you're putting the same hand on the nose, it might affect your system of respiration and get that infection into your lungs. So the simplest precaution is to have mask and sanitize yourself. Now, then I also want to tell you about this disease. It primarily affects your lungs. सबसे पहला इन्फेक्शन लंग्स का सिम्टम देता है, ठीक है. लाइक इट इफेक्ट्स द न्यूमेटोसाइट्स. लंग्स के अंदर देयर आर सेल्स कॉल्ड, आई विल जस्ट कम टू इट इन डिटेल व्हेन वी विल डिस्कस विद द पैथोलॉजी, लाइक हाउ इट कम्स इनटू बीइंग. Okay. Secondly, I got many questions like ये हर बार चेंज हो रहा है, एवरीडे न्यूज इज कमिंग डिफरेंट, कल कुछ और था आज कुछ और है, कई कह रहे हैं फॉल्स नेगेटिव आ रहा है, ठीक है. सो दीज काइंड ऑफ थिंग्स व्हिच आर अनप्रेडिक्टिव, बिकॉज रिसर्च इज स्टिल गोइंग ऑन. इट्स नॉट that we have got all the solutions. Only in Russia they've been claiming about a vaccination being discovered, but although it's not available right now at every place, today is 13th September. Till 13th September, we are not having any vaccination done. Okay. And so all the researchers are coming up and down. If the researches are going on, we are not sure about what is happening. So the results are unpredictable. Many times earlier it was to say that only it happens with the lung infection. But now the new research has come up, like it can also happen with the fecal infection. In case if you are toileting into a public toilet, or sometimes you're using some other's toilet and that toilet is not properly flushed up, or not, you have not cleaned that area, or you are using your dirty hands over there nearby places, the same knob other person is using, and that may carry your virus to your immune system. So it will decrease the immunity and give you the symptoms. Definitely, you need to take care that you wash your hands properly and do not use your hands on the face. Many times people use their hands, touch their upper, lower, any part of the face. But you have to make a habit that you do not touch your face at all to be protective. And in case if you are not able to do this, then what you can use is eye shield. Okay, there is a total eye face cover is available, or the eye goggles are available to make you just your mind remember that I do not have to touch this. Lower you can cover with the mask, eyes you can cover with the eye goggles are available, or you can full face shield is available. So you can use these kind of things because it is under research and you need to take care about all these things. Then the next thing I will come up to is what happens, how it occurs into, like how it starts into yourself. Okay, so basically the pathology. Okay, in pathology, what happens is we are breathing all the time, we inhale and exhale. Okay, so how does the normal breath comes into our lungs? First, I'll tell you what is normal. Normally, inhalation through the nose, through the windpipe, and then it divides into two. Okay, this is a windpipe or trachea, pipe is there, and then it divides into two, and there are further divisions. Each divided into two, then four, then eight, like this. A lot of divisions are there in the lungs. And the last point where it ends is called alveoli. Alveoli is just like a balloon. Okay, just have a look. This kind of balloon shape of alveoli is there. Okay, like this. And this kind of alveoli are having a lot of cells. Okay, this white patches, just remember, like it's a cells. Okay, the cells of the lungs are called pneumatocytes. What are they called? Pneumatocytes. There are two types of pneumatocytes. Pneumatocyte type 1. Type 1 is for air exchange. Like they will contract and relax. This will contract and relax, and exchange of air will happen. Okay, and type 2 pneumatocytes are basically which are producing surfactant. Surfactant is kind of thing which is there in the alveoli so that alveoli do not burst. Okay, it doesn't get empty. So that surfactant is there. So in what happens in corona? In corona, what there is alveolar collapse is going on. How? Because type 2 nematocytes are being affected and that surfactant production is reduced. Okay, if the surfactant will not be there, there will be increase in surface tension, then increase in the pressure, it might burst out the alveoli and the infection may be there, fluids may come into the alveoli, pani भर जाता है उसके अंदर, ठीक है. And what generally it affects the lower part of the lobe. Lungs have three lobes on one side, two on the other side, left side and right side like this. अगर जो lower part है lungs का, that is filled up with the water. Generally lower lung का जो lower part है, that is being affected. The lower part of the lung is affected, and when that surface tension is too much, that the alveoli burst out or some water leak is there, then our oxygen intake will be reduced. हमारे lungs में जितना फूलना चाहिए उतना नहीं फूलता है, जितना ऑक्सीजन अंदर आना चाहिए उतना नहीं आ रहा है. That means how much oxygen our body needs is not being produced at our alveoli and we are feeling hypoxic. Our oxygen content of the body will reduce and O2 CO2 mismatch will be there. Okay, our ventilation perfusion ratios are reduced. Ventilation is oxygen intake kam ho gaya. Perfusion is oxygen going into the blood. If the oxygen going into the blood is also reduced, the oxygen intake is also reduced, and what happens is secondarily there is increase in carbon dioxide content. हमारा oxygen नहीं आ रहा है, carbon dioxide बाहर नहीं जा रहा है, so we are having very difficulty in the breathing. Okay, and in case of the difficulty in the breathing, that will produce acute respiratory distress syndrome. Acute respiratory distress syndrome, what is this now? In this, our respiration is under the distress. We are not able to breathe out. We're not able to exchange the air. We are not able to clean up our good blood. Good blood is oxygenated blood. Deoxygenated blood is carbon dioxide blood, or the one which is having uh, like blueness is there. Okay, red blood is with oxygen and blue is with carbon dioxide. Okay, so blue content will increase, red content will reduce, so we are not able to breathe. Blueness of the faces are there sometimes. फिर क्या होता है, इसका effect will be on the other organs as well. This affects the other organs. How it affects? It might affect the liver. लिवर के अंदर इफेक्ट आ रहा है तो लिवर फंक्शन टेस्ट गड़बड़ जाएगा. When we go for the liver function test, the bilirubin content and other things will go reduced. If we see the kidneys, then kidneys will also be affected. Sometimes urine is not passed out properly. GIT system is shown a lot of means changes with the COVID. Like a person is having diarrhea, person having vomiting sensations because GIT system is involved. Intestines are basically involved and the oxygen intake in the intestine is also reduced because of this happens many times. Taste buds, person is not able to taste what is happening, he's not able to listen, olfactory lobes are having problem, and pharynx is because dry cough is associated with this. जो पानी तो भर जाता है but person is having mostly dry cough in this. Okay, and when the dry cough is there, all the pharynx and the infections over throat infections are there associated with it. So we need to take care what is happening, and accordingly we have to pursue. If our compliance will be low, surfactant will be low, work of breathing will automatically increase. We are doing breathing very difficulty, like that. Okay, and person is using the accessory muscles of breathing. He is not breathing from the lungs, like this is a lung breathing when no problem on the face and other things are there. And when you like this kind of thing, when you are using your accessory muscles, so person is not able to breathe properly. Dysregulations of the T cells are there. Basically interleukin होते हैं, like interleukin 6 and 17, these kind of things are there in the when the T cell activation. Basically I want to say is in the lung only there are some things which are being produced, some chemicals which are being produced, and that will give you reduction in the quality of your lung expansion and breathing and oxygen intake is reduced. And even there are increased, if you see, macrophages are increased in cytokines. I'll give you more, a little more detail for the physiotherapist, not for the public, this kind of things. Although I'll come back to the general public as well. What happens is this virus is basically RNA virus. Okay, and once it affects the alveoli, okay, I will show you again. अब alveoli के ऊपर हमारे यहाँ पे क्या है, pneumatocytes. I was talking type 2 pneumatocytes are basically सबसे पहले जो खराब होते हैं. Type 2 pneumatocytes are affected. What happens is on type 2 pneumatocytes there are ACE receptors. Like ACE receptors are there on which the RNA virus binds itself. This RNA virus is basically evolved up from, it is said from bat, then it goes to some other host, and then it had a mutation and then came to the human being. And when in pneumatocytes on the ACE receptor it binds, there are some spike proteins are there on with which it binds on the pneumatocytes. जब वो pneumatocyte के ऊपर bind कर जाता है तो pneumatocyte का अपना function gets reduced. He is not able, that pneumatocyte cell is not able to go for surfactant production, जिसकी वजह से alveolar collapse हो सकता है. Secondly, what happens is उसके अंदर bind करने के बाद it goes into the cytokines. though उसके अंदर जाने के बाद it multiplies itself, multiplies in more number of RNA viruses are produced. जब वो मल्टीप्लिकेशन प्रोसेस चल रहा है तो आपकी एनर्जी आपके लिए नहीं यूज हो रही, इट इज यूज्ड बाय द वायरस, सो पर्सन इज फीलिंग वेरी lethargic and oxygen intake also is reduced. Then after multiplication of so much of RNA, okay, then it is going to other parts of the body and then the spread of the virus is coming up. Or when we go for the COVID test, that is RNA transcriptase, I'll just go to the test also. What happens in the test is that RNA which is being multiplied is again checked up, okay, and then it's also multiplied in the by taking the swab from your nose or your mouth. Some swab is taken up, and that in a machine it is again multiplied. Then multiplication from RNA to the DNA, it is taken up and the coloration is added to it. A colored dye is added up. If that DNA coloration is there, that colorations will show that the same virus was there. In case if the coloration is not there, then COVID test is coming out to be negative. This is also related to the test. That is why we need to know how this disease came into our alveoli, and then how the test is working on it to reproduce that alveoli, to check it out whether it is there or not, and then classify it as positive or negative. So this was about the pathology. Then next we will be coming on exposed. How are we able to say that we are exposed? These days we are actually, it might be possible that everyone is having some or the other exposure, some or the other ways, but it might be possible we are not having symptoms. All of us are not having symptoms. So to have a precaution, just stay 6 feet apart, okay, or 1 meter distance should be there in between two human population, and try to even go very less outside. Even if it's very much required, try to go for online deliveries, and that is better. But going yourself into the crowd, creating a crowd is you should avoid. And secondly, go only if very necessary. It is very necessary. Otherwise, stay at home, stay quarantine. I also have many questions about what is quarantine, what is isolation, what is social distancing. Many questions upon this. So remember, what is quarantine? If I know that I have traveled somewhere, like I was to travel from Delhi to Goa or somewhere, I'm going on a flight, and then I know I might be exposed. So I will go for 14 days of quarantine. That quarantine, I had to sit at home, but I am able to do all of my work. I am able to do my work online. I'm able to go for the screen time. I'm able to see the television, movies. I can sit, I can stay healthy. I can go for exercises. I can do yoga. I can do my time pastime activities. I can play games. Online games are available. Many things we can try at home, or we can write book. We can go for gardening. We can go for painting, drawing, singing, dancing. All the activities can be carried out, but staying at home in the 14 days period. So that is said to be quarantine. And what is social isolation? Social isolation is when your test is positive, you're having some symptoms. Oh, you are 100% sure that you have been exposed and you are having COVID virus intake might be there because you are having the symptoms like dry cough is there, fever is there, and diarrhea might be there, some weakness, lethargy can be there, and it might affect to your eyes, it might affect to your abdominal core muscles might be weak, your liver problems might be there, urine test might be getting problems. So in such a bad situation when you are isolated, that is social isolation with having a symptoms. In those social isolated patients, you are not able to go for screen time. You should avoid your screen time, that is using the mobiles and laptops should be avoided because you're already lethargic. Your disease might progress to your eyesight also. In that case, you should take rest all the time. Resting can't be there, so you should go for a little light movements, gentle movements, like with breathing exercises can be done. There is a machine called spirometer. Spirometer has three balls in it. Okay, there are three balls and you have to blow. Okay, and whenever you are blowing that, inhale and exhale, both the modes it can be used, but in COVID patients inhalation training is more necessary because inhalation is something our muscles are doing and exhalation is coming out passively. Our abdominals are pushing it up and exhalation is passive. Inhale is something for which we have to work. So inhalation muscles have to be trained with the spirometer. There are three balls. You have to inhale, putting that spirometer straight. Like this is the three lines with the balls. I am blowing it out and the ball will rise up. Ball will rise up. Initially, you will just able to rise and slow, rise and short. Okay, but you have to make a habit of stopping the breath. Okay, whenever you are stopping, then you are pushing your lungs to inflate full. More inhalation will be there. Okay, so I am exhaling. I'll show you with the. I'll just get like in case if I'll show you with this only. Okay, if I am blowing in, this is exhalation. Okay, this is exhalation. And if we are inhaling or it's going inside, okay, this is inhalation. So whenever you are blowing out is exhalation, whenever you are taking in is inhalation. So inhalation will give you that ball rise. In that direction, you have to train yourself and you have to hold that for 5 to 10 seconds. I can inhale like this, the ball will stay up only. And for maintaining for 5 seconds and then slowly coming back to normal is basically making your lungs work on it. Okay, inhalation and exhalation. And if it is a small kids as well. And secondly, while using spirometer, just remember that the pipe should be straight and it should be kept in front of your mouth. Okay, it should not be on the lower level. Many people are putting it low or up. So you should take care that the pipe should be straight and it should be in front of you, and you are inhaling and the ball is taking up and you have to hold it for 5 to 10 seconds and then slowly relax. Okay, and try to go for 3 balls. This is for normal population also. As a precaution also, you can get your spirometer, which is a very nominal price, like it's about a 500 or so, and you can just buy it at home and just practice your breathing. In case if you're inhaling and exhaling and maintaining your breathing muscles, the breathing muscles are the first one to be get affected, so you have to take care of them. Secondly, I was talking about if it is a child, what will you do? You have to plan games with the child. Your child cannot do all the exercises himself, but you have to take care with the games. Like you can go for some Swiss balls, some small short balls can be taken up. I'll show you one ball is there. Like this ball is there. Okay, so you can make games. Like you have to put it up, inhale, exhale. Like this, and catching like this, inhale and exhale 2 balls at a time at like this. You inhale while kicking, exhale while catching, inhale while kicking. By multitasking can be done, so that light change of mood is there, some exercises are going on along with the happiness is coming up, person is laughing, enjoying, and this kind of things can be taken up. If there are in hospitals also, we are advising like game activities for the fully like little bit normal patients are there, and group COVID isolation is there. Whenever there is done, then we can go in for group exercising. They each other, they can take care of themselves, maintaining the distance and maintaining the masks. Okay. So this was another thing which I was telling about the old, even children and old age. We can try both of these things. In old age, the specific thing is falls. There are history of falls being seen in old age. So to train their core muscles is really mandatory in old age. Old age people are generally advised to go for yoga, meditation, and pranayam at a regular basis. Like alom vilom is preferred, but remember kapalbhati should not be done because it is very forced. And at that point of time when you're weak, you're not able to do that forceful things. So alom vilom is a good thing. Shavasana, breathing and meditating is good thing for old age to be starting the initial day. And in case if there are symptoms are more, then we can even go for Swiss balls, like lying down on the ground and putting the feet on the Swiss ball and just moving light left and right with the inhalation and exhalation. When movement is combined with breathing, it will give you definitely better results. Okay, and multitasking will also initiate your brain activities, so it will also work on your brain and along with that your lungs if you're breathing and doing multitasking. So this was about the old and what precautions you need to take. You just yeah, one more thing I left out was social distancing. Social distancing is just to maintain, it is for everyone, normal or not normal, everyone should maintain some distance in between. They should not go very close to each other, just as a protection. So it is a 1 meter distance you have to maintain between two individuals, like in banks or places outside. You can even see the government has given markings like you have to be apart while standing in a queue. So that is a social distance. And self quarantine, I've told you, if you're positive, you cannot go for screen time at that time. You have to do resting, yoga, pranayam, breathing exercises, a light bit of mobility exercises with breathing. You can even go for catching the ball, just sitting over there in passing time yourself and writing, or sometimes very short time of reading so that it doesn't strain your eyes. And you have to be you can write or you can sing, you can something of your choice you can do, but that is called self quarantine, sorry, isolation. And the quarantine is when you are not sure that whether you are exposed or not, but you are in a question in your mind in that time point of time. Then you can do all the kind of screen times, everything is allowed in those days, but you have to sit for 14 days at home. And what more precautions is like, because it can happen from the surfaces as well. So you have to, whenever you are going outside, coming inside, go for a bath, change of your clothes, change of your shoes. That shoes for outside should be different, for inside should be different. And you should wash your hands before coming, after going, like all the time you are outside the home, then you just keep a sanitizer with you. In the car you have to sanitize. If you're driving the car, you have to sanitize that steering wheel and the wherever you touch, like the opening doors and all, you have to sanitize those things. And you have to wear the face mask daily. You have to in case if you're a doctor, if you're wearing if you're very close to the patients, like in ICU, the PPE kit is must in the hospitals. And social distancing is must. Many times if you are doing social distancing but others are not able to do, then if others are not doing, you have to maintain that you are properly tucked up with your mask. And in wearing the mask, I've seen a lot of patients are just getting them into this patient life because they are wearing the mask but the nose is not covered, they are just covering the face. So remember, nose and mouth full should be covered. There should be a big mask. It should not be very thin one, okay, just to show the traffic policeman that I'm having mask, not like that. Okay, it is for your safety, not for your others. So you have to cover whole of your thing, and nose and mouth should be covered. And light exercises are mandatory for everybody. Best is to go for the flexibility, yoga, breathing, and pranayam, and even light, gentle exercises. I'll be teaching you at the end, and that exercises can be done by each and every person, and that is for general public only. I'll just come back to that in detail, so I'll come a little later on this. Then secondly, if you are sneezing, somehow you are not able to control your sneeze. How to sneeze in public? It should be like this. Okay, it should be in your armpit, and those clothes you have to change it after coming at home. It should not be in the public. And try to wear face mask again even while sneezing, and do not touch your face at all. If you are able to, if you're touching your face by anyhow, if you have already touched any surface and then hands are going on your face, that will make you again prone to have the disease. Then better to take online things. I prefer online shopping, and everything should be online instead of going there in the market, because it is quite risky. And till the time you can prevent, you should prevent, or you can give the orders on phone, the person can deliver, the neighboring person can deliver, like kind of things should be made like this. And sleeping time is really important. It has been seen that the people who are infected were not properly sleeping and not properly exercising, and we're having multiple other diseases which are effective on the negative side. So you should take about 7 hours of continuous sleep, 6 to 7 hours of continuous sleep, and it's better to take 7 to 9 hours, even it's possible, if possible. Okay, so minimum of 7 hours of sleep is mandatory to protect yourself from having COVID. And secondly, you should do exercise, like light exercises, walk at home, stepping at home. Everyone has stairs, you can go up and down on the stairs. It doesn't mean that you have to go in the park and public only, then only the exercises are there. Don't go to the gym, I can't exercise. It's not like that. You have to exercise at home if possible, or going just outside a little bit of your means garden or something nearby where the people are very less, or you are having a personal one, then it's fine. You can walk in your balcony, you can go upstairs, downstairs, you can even stand on one place and go for some toe touching, you're bending your back, upper back movement, but with inhalation and exhalation. See, observe yourself how you're feeling good in inhale or exhale in that point of exercise. Like if I'm going this side and coming back on this side, one side I have to inhale, one side I have to exhale, and inhalation is going down, exhalation is coming to the center. Inhalation is going down, exhalation is coming to the center. If I'm kicking the ball, inhalate and exhale in one or the other moment. You have to kick the ball once, you inhale and relax, then exhale, like this. Any difficult movement, whichever you find difficulty, inhalation is something active work. Okay, in difficult work, add something easy, that is exhalation. Exhalation is coming up passively, अपने आप ही exhale हो जाता है. आप inhale करने में मेहनत लगती है, exhale में नहीं मेहनत लगती है. I'm inhaling, it's easy, exhale. So easy exhales add to the difficult task. जो भी, if I'm putting a dumbbell in my hand, it's pulling a dumbbell is difficult task, so exhale. And relaxing is easy, so inhale. Any easy thing you inhale, any difficult thing you exhale. But do movement and exercise and breathing together. Okay, that will give you the best results. And then remember to take care about your hygiene. You should bath daily, even twice a day in case if you're going outside, and go for a hand cleaning all the time, and change your clothes. Just take care of your neighboring area. You're maintaining that dusting part should be done properly, so that accumulation of dust is not there. The doorknobs we are touching every now and then, those should be cleaned with the alcohol. And how to choose the alcohol. Hmm? Choosing the alcohol, even I have seen that I being a physiotherapist, I also do fire cupping very often. So I go for the alcohol and burning that swab with the alcohol, and I found that with the alcohol sanitizer, the fire was not burning up. So it was very odd for me that if it is an alcoholic, then how the fire is not catching up on it. So I came to the solution that I always check my sanitizer. If I buy any sanitizer like this, I have to check that sanitizer by putting drops of sanitizer on any cotton swab, and then just trying to lit that with the matchbox I've lit up, and the fire is, if that catches the fire, it's very light thing, small swab, you can just put 1-2 drops of that and just try to put the fire on it. If it catches the fire, that signifies it's alcoholic. And otherwise, many times in the market there are available, the alcohols are available, these alcoholic sanitizers are available, but they are not catching the fire that suggests that it is just water, not the proper sanitizer. It's not having the proper percentage of the killing alcoholic sanitizer to kill the germs. And this is really important to check that you're not using watery. It should be proper sanitizer with having all the isopropyl alcohol is basically used over there, and it is basically used to kill the germs. And this was about the precautions. Then now I come to the symptoms. How you can be sure that it is COVID. What is the symptoms? Many times it is having symptoms. Two other diseases are having mixed symptoms, like bronchitis complaint is there or asthma complaint is there. People are saying I am not able to judge whether it is COVID or an asthma attack coming up. So remember, whenever it is COVID, you will have fever of at least more than 100, like 104 mostly. It's considered 104 degrees centigrade of fever is there, shortness of breath is there, person is able to not breathe properly, dyspnea is there, he's using the accessory muscles many times, like this, he's lethargic, breathing capacity is reduced, cough is there, but cough is mostly dry cough, it's affecting your this throat area very hard. I'm not able to touch it. Swelling kind of thing is there, and heart rate is increased many times. Chest pressure, chest pains are very common. Chest pains are too common because it's affecting the lower part of the lungs, and the chest is like burning. Like they are saying, people are saying like I'm somebody is just killing me. I'm not able to breathe properly. Chest pain is so severe, body aches are there. Then there are sometimes even mental status is abrupt, person is feeling very lethargic and he is not able to go for proper touch, smell, taste, sensations are lost many times. And it has been seen that vitamin D levels, vitamin C levels and zinc levels are reduced in these kind of patients. This if you are sure that you keep on getting a test on of vitamin D. If vitamin D is low for the normal person also, he is prone to have this disease. It has been seen with the researchers, but this research is under again going on. It's changing many times. Very rarely in COVID patients there is seen like toes are purplish in color, or sore throat is too much, and sore feet are also there. And but another symptom of GIT is very common, like diarrhea complaint is seen by many of the people, nausea, vomiting, rashes, delirium. Then comes the upper respiratory tract infections can be there. Self confidence is reduced, person is not able to breathe properly, not able to sit for long time, not able to speak for long time. So anything can happen, his mind can go into the negative direction, negativity attracts you. That is why it is said to breathe in and breathe out, go for some breathing exercise daily, so that your oxygen content is proper and you do not go to negative thinking. Okay, heart rate it is increased, the respiratory rate is increased. Then we also have a thing called pulse oximeter. Pulse oximeter can be taken up at home in case if you are affected with the COVID. Pulse oximeter is just a like of clutcher, okay, click over here, and it is having a button on it just to show you heart rate and SpO2 level. SpO2 is basically the saturation of oxygen, and heart rate is normal heart rate lies between 70 to 200. Mostly it should not cross 100. Even if you are talking, like if I'm talking, it might increase heart rate to 100, 100 and maximum 105, not like that, not more than that if you're exercising, light exercising is going on. But if it is crossing more than 105, your respiratory rate is rising, your SpO2 is basically uh, getting lower than 90, then it is a sign to go to the hospital and check yourself. Okay, and blood pressures drops mostly in this because your heart has to the proper oxygen content is not going on, and fetal edema is seen. When fetal edema comes up, your blood doesn't reaches your heart and you go into the hypotension. Lymphopenia can be there, like lymphocytes are the cells which go into that. Cell part is something microbiological, so I'll not discuss in this seminar. And then we can see the changes can be there into the neighboring joints, like kidneys can be affected in kidney function test, livers can, if liver is affected then liver function test will go abrupt. And similarly all parts of the like GIT system can be affected, your spleen can be affected in case those ESR content, CRP content ये सब बढ़ जाते हैं. many other things that is a little more detail. We can have discussion for the doctors when that time I'll discuss those things, but this is also for the general public. So I wanted to tell you that what precautions and contraindications and how to be sure that we are affected. What are the symptoms? People are asking, how can we judge ourselves that I am having this disease or not? In those kind of things, we have to know that our clinical features. What are these? Okay, so the tests which doctor advises you. Next is coming the investigations. अगर आप जाते हैं हॉस्पिटल में, what the test will come up. People will go for your fever check. There'll be a fever check first of all, more than 104 mostly. SpO2 will drop less than 94 mostly, and X-ray chest can be taken. In those chests, there are ground glass opacities being seen, and especially in the lower part of the lung. अगर ये lung का है size, lung is basically क्या है? Spongy like structure है, sponge like structure है. Okay, and in the lower part of the lung, it is being affected. Okay, I'll show you. अगर ये लोअर पार्ट ऑफ द लंग इज इफेक्टेड, ठीक है, तो यहाँ पे ही आपको प्रॉब्लम्स नजर आएंगी एक्सरे के अंदर भी, लोअर पार्ट ऑफ द लंग्स में. तो उसको चेक करने के लिए देयर आर एक्सरेज बीइंग डन. द हिस्ट्री ऑफ ट्रैवल इज नोटेड इन केस यू नीड टू बी क्वारंटाइन और आइसोलेशन कैन बी डन अकॉर्डिंगली. आपका ट्रैवल हिस्ट्री था, देन यू आर प्रोन टू हैव दिस डिजीज. योर फ्लू टेस्ट इज चेक्ड अप, कोई फ्लू का वायरस तो नहीं है, इट्स कोविड और फ्लू वायरस. कोविड स्वैब इज ऑल्सो टेकन टू टेक योर RT-PCR test of the COVID test is taken up. Then liver function tests are done. Influenza test can be done. Bacterial infections can be ruled out. Heart rate, respiratory rate, blood pressure can be checked up. Blood pressure ज़्यादातर low हो जाता है, respiratory rate ज़्यादातर बढ़ जाता है, heart rate ज़्यादातर बढ़ जाता है. RT-PCR टेस्ट जो है वो भी 100% श्योर नहीं है, इट इज अबाउट 80% श्योर. ओके, 70 to 80% श्योर है कि उसमें स्पूटम चेक करके दे चेक द ग्रोथ ऑफ द वायरस. इफ द ग्रोथ ऑफ द कलर डाई के साथ उसका ग्रोथ बढ़ा हुआ देखते हैं, अगर कलर इंक्रीज हो जाता है तो दे आर श्योर दैट you are having this COVID virus positive. Then there are nucleic acid tests are there. Even there are bilirubin content भी high हो जाता है, liver function tests भी होते हैं, ELT में प्रॉब्लम आ जाता है. CT scans can be done. CT scans में काफी अच्छा पता चल जाता है कि अगर ये पॉजिटिव है कि नहीं है, because in CT scan basically it's in the higher stage when you have pneumonia or consolidation of the lung. जो लोअर पार्ट ऑफ द लंग है वो हार्ड हो जाता है, कंसोलिडेटेड हो जाता है, क्रेजी लाइक पैचेस आ जाते हैं उसके अंदर. इट इज बेसिकली थिकनिंग हो जाती है अंदर के सेल्स की, और एडिमा आ जाता है, पानी यहाँ पे भर जाता है. अगर लोअर पार्ट ऑफ द लंग में भी पानी भर गया है, उसके आसपास के जो यहाँ पे आर्टरीज जाती हैं नीचे, उसके आर्टरीज के अंदर से भी एपिथेलियल लाइनिंग में से लिक्विड का बाहर निकलता है लिक्विड. ओके, एंड व्हेन दैट लिक्विड एरिया इज देयर इन द लोअर पार्ट ऑफ द लंग्स, व्हाट हैपेंस इज पर्सन इज नॉट एबल टू ब्रीथ. द पानी भरा हुआ लंग्स में कह देते हैं, जिसकी वजह से ऑक्सीजन इनटेक और भी कम होता जाता है, and then symptoms might increase. So that is why, because it is in the lower part of the lungs, it is advised to lie down in the prone position. उल्टे लेटना ज़्यादा better कहा जाता है इस disease में, so that whenever you are lying prone, that means उल्टे लेट रहे हैं, तो there are quite benefits like lower part of the lungs will get aeration. जो पानी है वो आगे की तरफ आ जाएगा, और पीछे की तरफ जहाँ पे सर्कुलेशन बहुत रुका हुआ है वहाँ पे दोबारा से it will again restart. So that is why prone positioning is preferred. Many other reasons are also there for prone positioning, because heart will go put all the weight on the front part. That means on the xiphy sternum, bone पे ऊपर heart का weight आ जाता है instead of lungs के ऊपर, जिसकी वजह से lungs का expansion पूरा होना शुरू हो जाता है, लंग्स के ऊपर हार्ट प्रेशराइज नहीं करता. इवन GIT सिस्टम जो हमारा है, इंटेस्टाइन वगैरह, वो सारा कुछ का वेट जो है उसका एक्सपिरेशन के टाइम पे जो ऊपर को पंप मारता है लंग्स की तरफ, वो थोड़ा सा रिड्यूस हो जाता है, जिसकी वजह से ऑक्सीजन इनटेक विल बी बेटर इन द लोअर पार्ट ऑफ द लंग्स वेयर द डिजीज इज अफेक्टिंग द लंग्स. उस जगह पे जब आपका वेंटिलेशन परफ्यूजन रेशियो बढ़ जाता है, ऑक्सीजन बढ़ जाता है एंड circulation बढ़ जाता है, then it will be better. So it is advised to lie down prone. Even ultrasound tests हमारे कराए जाते हैं इसके अंदर, उसके अंदर भी pleural thickening और B lines वगैरह, consolidations वगैरह चेक करते हैं. कि अगर उसमें वो सारी चीजें आपकी पॉजिटिव साइड पे जा रही हैं, आपकी एबीजी वैल्यूज डाउन जा रही हैं, FiO2 वैल्यूज डाउन जा रही हैं, ऑक्सीजन इनटेक कम हो रहा है, पार्शियल प्रेशर ऑफ ऑक्सीजन रिड्यूस हो रहा है, ये सारी चीजें जो रिड्यूस होने की, ऑक्सीजन कंटेंट्स जब भी रिड्यूस हो रहे हैं, दैट मीन्स यू विल नीड हॉस्पिटलाइजेशन. इफ it is maintained, then you need social isolation. Accordingly, your doctor will check and will guide. Okay, this was about the investigations and RT-PCR test. मैंने आपको पहले ही बता दिया. In those tests, your RNA virus is multiplied, then changed to DNA. क्योंकि RNA को DNA में convert करें तो इसलिए reverse transcriptase इसे कहते हैं, because DNA to RNA is transcription, RNA to DNA is reverse transcription. तो reverse transcription polymer chain reaction test होता है RT-PCR, that is being done to check and rule out your COVID. एंड वो भी एकदम से नहीं कराना होता है. आफ्टर 2 to 3 days the results come seem to be positive, and if no fluorescence is there, then it is said to be negative. देन ब्लड टेस्ट भी कराए जाते हैं जिसके अंदर हमारा, क्योंकि कोई भी डिजीज हमें होती है तो हमारा जो सिस्टम है बॉडी का, दैट विल रिलीज द इम्यूनोग्लोबुलिन्स. इफ एवर यू आर अफेक्टेड, योर body will release immunoglobulins. So the blood test can be done to check out these immunoglobulins. Immunoglobulins are of two types, IgG and IgM. IgM is the one which is primarily coming up, that shows that disease is just now it has affected. And if IgG is positive, that means it's IgG is secondary. Okay, first IgM comes, then IgG comes. Accordingly, we need to check like how much time has been passed that you are affected, whether you are able to pass it up or not, and then whether further things are also being done. If you are cured up, then also you will have that IgM antibody, and sometimes these antibodies are taken up from your plasma and the plasma therapy is given. And the people who have been affected from the COVID and got cured with the COVID, those people give their immunoglobulins from their blood plasma. They donate that small amount of blood that is taken mostly from the biceps over here, the injected and taken up from the arteries. Some blood is small amount of blood, about 200 to 300 ml of blood can be taken up, and that blood is checked up with the immunoglobulins and blood tests are being done, and those having very small amount of the plasma, that plasma is collected, and in that basically immunoglobulins are there which have been injected to the severely compromised patient, and then that plasma therapy is also shown having good results, but it is quite costly, so people are not undergoing very regularly about it. But the best thing is if you go for few gentle exercises daily as a precaution, that I have to exercise minimum of 30 minutes a day. You have to exercise, out of which 15 minutes mandatory to be done along with breathing. Okay, so this kind of things is generally you should do to prevent all these things to come flaring up. Okay, then if we talk about supplements, vitamin D, vitamin C, K, E, D, zinc, total time of sleep, eating properly, time pe khana khana hai. If there should be disciplined life, morning getting up at this time, then sleeping at this time, eating at this time, breathing so much, exercising so much, 30 minutes morning, 15 minutes evening. After every 2 hourly, I'm monitoring my posture. I'm doing a little bit of exercise of breathing, and then going back to my just taking up my schedule back. So every 2 hourly, give an alarm to yourself. Am I okay? Am I doing any exercise? Am I moving, or I'm just sticking to one seat and just sitting on one bench from morning to evening, and I'm expecting immunity? It's not like that. Okay. If you are just sitting to one bench and on screen for so long hours, you're already compromising your immunity. So every 2 hourly, just get up out of your seat, move here and there, and especially go for some breathing exercise. How simple person can go for breathing is inhale and arms up, exhale and arms up. I am sitting from long time with you, so I'm also doing along. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Okay, very slowly you have to do, okay, and just move your body whole throughout, just rotate left and right. You can go for marching and sitting if you're not having time to go out of your table. At least in sitting you can do. Inhale and exhale while doing marching, okay, like this. And your knees are up and down, your knees are going up and down, and you are inhaling and exhaling. Such kind of few movements every 2 hourly every person should do wherever he is. Okay, and just don't be too much involved in anything. Don't go for even news hearing all the time. People are all the time hearing abhi kitne बढ़ गए covid में इतना disease हो गया इतने मर गए. Don't go for so much of news that you just disrupt your brain into a negative thing. Always go for some laughing activities. Just go and laugh with your family, with, either on the jokes, or just have a laughing 5 minutes on. Yes, we are going to laugh for 1 minute, say. Okay, start. Ha 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 ha. Like this with whole of your family. If you're laughing, you're enjoying, you are having some good time, your immunity will boost up. Whenever you're laughing, your cells getting more oxygen, and in case if you're more oxygenated, you will have good immunity. Okay, and then now if in case somebody is affected, what will he do? And the medicine part of medicines are there. A lot of medicines are given. Antibiotics are given basically that to reduce the fever. Some either IV fluids are given, or sometimes to reduce the fever, the medicines like Tylenol or some antibiotic medicine basically is given to reduce the fever. Then there are given to inhibit that RNA dependent RNA polymerase reaction को reduce करने के लिए, so that the RNA virus do not regrow. Sometimes a medicine called remdesivir is given. Then antimalarial drugs like chloroquine were given already, but now the recent research says that it's not said to be effective. Like ritonavir protease inhibitors are given to inhibit the virus to getting progressed into your type 2 hematocytes. Then DMARDs are given, steroids are given to reduce the severe chest pain, and interleukin blockers are given. These are given to reduce again the chain reaction is reduced, and the plasma therapy, as I've already told you, that good the already recovered patients give their plasma, donate their plasma to the very ill patients, and that plasma is giving the immunoglobulin reactions so that the disease is not progressed. So plasma therapies can be given. Blood thinners are given. Why blood thinners? Because many times there is a consolidation in the lower part of the lung, and what happens with the consolidations, that when the consolidation is there, it is happening, it's blocking the pathway of the arteries, so it may result in the clots or emboli. To clots are basically when a pipe is blocked. अगर ये pipe है उसके अंदर blocking आ गया है. Okay, so block is said to be a clot, or and if it is moving clot, that's embolus. So to thin that blood thinners are given, like heparin is given, so that your blood is having very light thinning, so that that accumulation of the clot is not there. So these kind of things can be given in the medical treatment. ACE inhibitors are given so that this again disease doesn't progress, because it is affecting the ACE receptors in the lungs and anywhere else. And as then comes the angiotensin receptor blockers can be given again to like thiazolidine. Some medicine is there like angiotensin blocker. I Yeah, that is basically to reduce their heart problems. Okay, in case we are not giving that, then heart problems can be there, and anti-inflammatory drugs can be given, like ibuprofen can be given. Anti-inflammatory drugs basically to reduce the inflammation, and if the inflammation is reduced, there is more lung capacity, more lung volumes are there, and more circulations are there, and even fetal edemas are commonly seen in these patients. So to reduce the fetal edema also, we prefer that anti-inflammatory drugs, and we also go for a leg elevation. Okay, foot elevations can be given to reduce the fetal edema. Every time whenever you are having exercises in the COVID patients, you must check the edema after 2-3 hours of exercise as well, because it might be possible that with the exertion person cannot tolerate, and the blood is getting accumulated in the feet. So fetal edema is there. The properly pumping is not happening because person is very lethargic and the system is not working properly. So just to check this and the related complications, if anyone was having diabetes is there, or already chest infections are there, or already cardiac problems are there, like myocarditis is there, then the disease of that, uh, in myocarditis also, that ACE inhibitors and all, everything is given according to the disease. Some medicines are given, and from earlier diseases other than COVID, and then uh, COVID medicines are also given. So we have to be sure what we have to give, and that is under the supervision of the doctors. Only we should consult our doctors when to be getting admitted and when not to be. If the symptoms are light, we are classifying it as mild, moderate, and severe. If the mild symptoms are there, then you can just go for self isolation at home. If moderate are there, then it has to be checked how much moderation levels are there. If you're able to tolerate, initially it is advised to be at home. And in case then you are advised also to take that pulse oximeter. If that on oximeter, if you're seeing that your heart rate is increasing too much, or your oxygen levels are giving very low, less than 90, then you have to be admitted. Okay, and these kind of things you have to check on, like heart rate going more than 150, like 100 plus is always a risk factor, so you cannot stay at home, you have to be admitted. And if we talk about the guidelines to treat, or as a physiotherapist, what precautions we need to take care, we have to wear the face shield. We have to check our own fever with the fever that the temperature gun we are having. We generally check the patients, but we do not check ourselves. So every day, even the doctors should get their fever check done. Face masks should be there with the doctors and with the patients both. Social distancing should be there with everyone. Try to touch only when it is mandatory. Otherwise, just avoid your touch and try to explain the exercises either online or with the distance maintenance, and recheck the patients. But with the, you can maintain that exercise time, reducing it to online exercise time. Okay, you can go for online exercising. Online exercising is also totally safe. Patients say that I am not able to uh, and like I don't know what to do, what not to do. But online exercises also give good results if it is done under the proper supervision. I have been treating many patients with online physiotherapy as well, and all of them got improvements. And along with that, stop working if the clinical features are there, like dry cough, already I've explained. Hand hygiene should be maintained. You should wash your hands with soap and water for 20 seconds at least. People are washing, but only 1 second or 2 seconds. 20 seconds. A happy baby song you have seen, and a happy birthday song. Till that happy birthday song is going on, you have to wash your hands. Okay, 20 seconds of hand washing with the proper soap and liquid, or hand sanitizing with the proper alcoholic content, so that the germ free, you are sure about being germ free. And then donning and doffing of your dresses should be learned in a proper way, like how to wear the PPE kit, how to wear your mask. Every time you remember that whenever you're touching any of the things, you have to sanitize before wearing mask, after wearing mask. And if it is a doctor, we should say, then he should wear a gown, proper mask, proper eye mask, goggles can be wear, and those kind of things you have to go for sanitization. Like even before taking your seminar, this webinar, I also cleaned all my nearby surroundings with the alcohol swab. I took that hand sanitizer, sanitized all the places nearby me, so that whenever I'm touching even any here and there, and unknowingly, if I'm touching my face, it's totally clean and clear. Okay, so remember that you, wherever you're sitting, neighboring area should be clean, and eating place should be defined. It should be always on the table and chair. It should not be kabhi yahan kha liya, kabhi wahan kha liya, not like that, because you need to be sure that your neighboring area is clean and sanitized. Just before eating, just sanitize your table and neighboring area, and even go for a hand sanitizer. Wash your hands properly before and after eating. And disposable bed sheets can be used whenever you are in the OPD premises, or a plastic bed sheets which can be sanitized can be used. And if you are in the OPD and if gone for the physiotherapy treatments, and in hospitals, generally we go for a disposable bed sheets, or again sanitizable bed sheets. And use and throw masks are the best to use if you can get those, for the patients and for yourself as well, because it will have reduced risk of transferring the disease. Gloves should be used whenever you're going in any hospital setup, so that you do not touch any surface and get that problems inside you. Shoe covers can be used if you're in the hospital or OPD premises, and disposable things should be are better, so that it can be thrown up and you do not have to care about whether you are washed properly or not or something. If otherwise, if you want to a reusable one, then it should be of good quality so that it doesn't reduce its effectiveness. Then in physiotherapy, if we can say that there are a lot many goals, like strength training is the main goal you have to check for. If anybody is coming for your OPD visit, like even for neck pain or back pain, you should go for some strengthening and one more breathing exercise. Just combine the strengthening with the breathing. If knee pain ka koi patient aa raha hai, if somebody is having knee pain, if you're advising the quadriceps exercise, that is knee muscles exercise, then advise them with the breathing. If you're pressing and doing that exercise, you have to inhale. While you are relaxing, you have to exhale, like this. Combine inhale and exhale with all of the exercise. And remember that falls are very common. Core muscles are getting very weak in these diseases. So advise one balancing exercise. Stand on one leg, you just say like that, or sit on a Swiss ball and do the exercises. Even if I'm having neck pain, I'm having some neck exercising, I'm doing some neck isometrics over here. If I'm sitting on the Swiss ball, I'm doing, then my core muscles are also getting activated. And instead of counting 10 over here, I can do inhale, exhale. See, I use my accessory muscles. It's like this. Person you have to guide, do not use accessory muscles. Then this side, I'll do the normal one. I'm pressing, inhale, exhale. I'm not using accessory muscles. This is use of accessory muscles. This should not be done. And this should be done like inhale, exhale. Light breathing, light activation of your neck muscles, this can be combined. Okay, so breathing, activation of your strength muscles, and sitting on a Swiss ball or imbalance is being given, like wobble board standing and doing, or standing on a sitting on a Swiss ball can be done with the old age group. So these kind of things, अगर आप लेट के करा रहे हैं, even लेट के, if you add a Swiss ball under the, whenever a person is lying on your back, putting the Swiss ball under the foot and then doing some exercises for the general any kind of disease, if you are treating, not only the COVID. Okay, just add these three exercises. And in case if it is a COVID positive patient, then you have to make sure that the proper one cabin is defined for that patient. It's properly sanitized, and proper the distance is being maintained. It's not like that you have to avoid those patients like इससे दूर रहो, ये तो COVID positive है. It's not like that. You have to take precautions and then you have to treat. You should not be very rude to those patients. And all, after all, they are also human beings, isn't it? You should not give them such a negative thought like, I'll not touch you, I'll not meet you. Social distancing is needed. You can go for a webcam, or you can even advise them exercises on the webcam, and you can go only to the gentle things with distance which can be maintained, and little precautions can be maintained. You can wear a PPE kit, properly cover yourself, and then treat those patients. But you have to treat, as being a doctor, you have to treat, and you do not have to say like why you are positive, like why you just go out of my clinic. Don't behave bad to like that. Even people are behaving very bad with COVID positive guys. Please do not, they are also human beings. Okay, just make them feel that they are human. Okay, anybody can have that disease. You have to be gentle and curious while talking to them, while behaving properly with them and helping out them, just giving precautions, taking yourself precautions so that this disease do not spread at all. And mask and hand sanitizer is something you should carry with you every time. Okay, and if we come to the physiotherapist, then physiotherapist will check all of your parameters like fever, SpO2 levels, history, how you had it, code, balance, training, BAS, that is the pain scale. He will take how much pain is there, are you dyspneic, your respiratory rate, is it high, rising, oxygen content, it is low or high, and how much distance can you walk with ease, can you walk upstairs or downstairs, do you have warning signs like shortness of breath, any blueness, chest pain, shock, shock-like sensation, very much lethargic, mental deficits, then admission is necessary if these warning signs are positive. Otherwise, you can go for the OPD treatments. Like OPD, we go for strengthening exercises, ताकत बढ़ाने वाली, breathing exercises, inhale and exhale, पेन रिलीफ exercise treatment. अगर वो पेन किसी weakness के करके, then we'll go for a strengthening exercise. If that pain is because of inflammation, then we'll go for an anti-inflammatory treatment with the machines like ultrasonic and all other kind of things. There are a lot many machine treatments, icing, other things are there. If it is advisable, according to you, the therapist will decide what is best for you. These days, cupping therapy, many other things, dry needling, much of the things are available. But again, specific to the COVID person, the research is under the study. But according to the physio, whatever is best for you will be given to you, maintaining the proper precautions. So flexibility training is given, balance training is given. Flexibility training is also good with the yoga. So you can even go for yoga at home so that you are already flexible, balance gain is there. But even if you go for yoga, it doesn't mean that you will not be affected. Any yoga people are also affected. Okay. So in that case also precautions is must. In case if you're doing it in public, you have to take care that your mask is there, you're sanitizing your hands, and even the yoga mat you are sanitizing daily. Okay. And diaphragmatic breathing is something which is advisable. There are two types of breathing which is really important, and as a physiotherapist I'll guide you as a chest physio. Like one is called diaphragmatic breathing, in which the front part of the this is expanding and going down. Lungs are expanding and going down. Just keep your hands one at your chest, one at your abdomen. Just see, one at your chest, one at your abdomen. Inhale, and everything will go out. Okay, feel that out. Exhale, and everything will go in. Okay, inhale, exhale, inhale, exhale. I'm light exaggerating so that you can see. Inhale, everything out. Exhale, everything in. So this is front part of breathing. You should do 2 minutes daily. And then we come to side parts. Okay, laterally. Just see. I'll keep it over here. Inhale, exhale. Okay, inhale, going out. Exhale, coming in. So whenever you're inhaling out and in from the sides, it is lateral breathing. When you're going front, that is front breathing. So the front one is diaphragmatic. You have to, these two breathing exercise you should do daily. You should practice some breathing exercise lying on your prone, like lying ulte let ke, pet ke bhar pe let ke. If you're lying prone, that is always good in COVID cases because it is affecting the lower part of the lungs, and on that the weight is reduced when you are on lying prone. Okay, so that part of the back side, lower part of the lungs are inhaling and exhaling. Just you can, for keeping it into your mind that I have to activate that area only, what you can do is just put two glasses, some steel glasses, so that they fall and you do not have any problems. Some two glasses on your back, and you're going prone. Okay, on prone position, you have to maintain those two glasses on your back, and when you are inhaling, they should go up. Exhaling, they should go down. So these kind of biofeedback things can be added up so that you are activating all the parts of your lungs while breathing. So this kind of things we are practicing already in our clinic. We are advising our normal patients with some light pains, any kind of back pains, neck pains also if they are coming, we are advising the breathing exercises along with that. And in yoga, I have already told you Alom Vilom is good in case if you are practicing daily. Then we come to the ICU management. In ICU, there are a lot of things to be cared of, like breathing, edema, some jugular veins, distensions are there or not, oxygen saturation, swelling in the legs, then listening to the breath sounds. That is also done with very precaution, like PPE kit is always on over there. And although ICU is the best area because over there, person is all the people are taking good precautions. Just coming out of the ICU, you're forgetting that you are a physio or you are a patient. And then when you are out of the ICU, then generally people have infections at that point of time when they are not taking any precautions. In ICU, everyone is taking lot many precautions. So best part is that in ICU, no infections mostly happen because you are curious. So remember that you have to be curious all the time. It's not only the ICU is the place where you have to be cautious to take the precautions. Okay. So evaluations of the other investigations, which I've already explained you, these the heart rate, BP, shortness of breath, CT, X-ray, ultrasonic, SpO2 check, RT-PCR test, all those things which I've explained already. These are being tested in ICU, and after that you are being checked like warning signs are there or not. Warning signs are basically chest pain, shortness of breath, blood pressure dropping more than either dropping systolic blood pressure is either less than 100 or more than 200, then you have to be monitored and you have to check up if the ventilator demand is there or not. Ventilation perfusion ratio is being checked. Oxygen saturation जो आपका pulse oximeter से हम check करते हैं, that is also अगर 88% से down जाता है, less than 88, it is a warning sign. You have to be admitted as soon as possible. And respiratory rate, we have to check अगर that is increasing more than 28 or less than 10 per minute, then you have to be admitted and have to be taken good care of you, like ICU is needed. And then pulse, if it is rising more than 140 beats per minute, then also ICU is required. And in X-ray findings, we have to check all that the lower part of the lungs is infected, any consolidations are there. To confirm, we can go for the CT scans and ultrasonic scans. And then how much pain is there, chest pain VAS is being checked, that is visual analytic scale, that how much chest pain from 0 to 10. If 10 is the maximum, 0 is the least, then how much is the pain today, so that we have a scale of checking whether it is increasing or decreasing. Then we can check for balancing, if you're able to balance, if you're able to walk or not, sit or not, talk or not, and anxiety or stress is there or not, then we will check that. And along with that, we'll make a list of goals, what we have to check, like or what we have to treat. Then like vitals are maintained or not, functional capacity we'll check, respiratory capacity we'll check. There are a lot many things ICU guys are checking up, and accordingly they'll plan up your physiotherapy treatment. As a physiotherapist, I'll be guiding more about physiotherapy only. In physiotherapy in ICU is basically is to chest physiotherapy. In chest physiotherapy, breathing exercises are the best one which are advised over there, like spirometer is advised, inhalation trainings are given, then inhalation to exhalation ratio variations and training with that, steadily increasing your inspiratory capacity, your inspiratory muscles are being trained, oxygen therapy is given, and exercise mobility is given, spirometers are given. Then there are therabands are there. The band trainings can be given. Patient is advised to put the band over here, inhale and exhale, so that the band is going out, and then you are able to know that my chest is moving. Hand breathing, which I've already explained you, front and lateral, that is explained to them. Then mostly huffing is advised than coughing, because it is spreading up the air droplets. So coughing is not advised in that case, so that because coughing will spoil the environment, and other people can also be affected. Moreover, there is very less, there is a productive cough, it is generally dry cough. So huffing techniques, ACBT techniques, we say, that is a little more detail. Then basically huffing is like and coughing is so coughing is not advised, and huffing can be advised in some situations if there is a lot of fluid accumulation is there, and that too in specific environment is being created so that it doesn't spreads. Then core muscle training can be done. Little bit of tummy tucks. Core doesn't mean that you have to do planks. Okay, always people say core means planks. Not like that. Core training can be done with the affected patients. Like you just say tummy tuck, tighten up your tummy. Okay, like you're going for a photograph shoot, and then eh, open it up, fill the air into it. Inhale and make it fat, and exhale and make it thin. Okay, so this kind of tummy tucks can be advised. Then weight shifting can be advised, forward, backward bending. When you are going forward, when you're going backward, there is inhalation and exhalation is mixed up into it. Like forward, exhale, inhale and come back to the center. Inhale, go back, exhale and come back to the center. Such kind of trainings can be given in the bed. The exercises can be given at the edge of the bed. Move till the edge of the bed and come back to the center. Stand and sit. Sit to stands can be given. Then squatting exercises, light mini squats over there. Stand and squat and then sit down, and try to go to the washroom. then go for some stepping. Okay, and 6-minute walk tests are done to check whether the time is increased, duration of walk is increased. There is a grade so that how much the person can. 3-minute walk test can also be given in a person who is not able to do. And in case if it is highly severely problem is there, then in ICU we go for pursed lip breathings can be done. Diaphragmatic breathing is the one which is doing front. Lateral costal breathing, that is from the side. The pursed lip is when you are exhaling with the lips like this. Okay, small lips, purse of lip is made and exhaling like that. Blowing the candle can be given. If it is a child, just give him a candle, blow the candle like this. Okay, but not, you have to extend the foo long, long. Okay, give him 4 5 candles in a row. Just go for 4 5 candles going off with your blowing air like this. Children can be given. And then psychological training is really important, because that is an environment in which looking here and there, looking at the news, looking neighboring persons all lying like this and going in deep respiratory pains and chest pains are there. So that is the atmosphere in which person can go negative. So either a psychologist is given over there, or even if a physiotherapist is given, everyone should go and meet properly, giving the wishes like get well soon, or giving good morning, good afternoon, just telling them time or talking to them a little that you don't worry, you'll be positive, you're better than before, or anything like this. And you should make their time good. Okay, and either make them give some game to solve, like if he's a little active, you can go for any written up game, or write the names of 5 persons at your home, anything, so that or remember those 5 persons, five in an order, just play with each other. Okay, if the neighboring people are there, instead of talking negative, they can talk good. Five in one row, exchange their papers, and then or talk about any 5 people in your home, and then remember those 5 in that order: A, B, C, D. I gave 5 names: A, B, C, D, E, and then in the reverse direction, or E, D, C, like this, you have to answer the names. Like this, any games can be created in the hospital atmosphere among the patients in a neighboring area, so that instead of making them a little busy, okay, if they are active. And if in their in case they are not active, they are on the mechanical ventilator or something like that, in those cases the all the machines are basically used, vibrators are used, low tidal volume is preferred, so that their alveoli has some, or the PEEP is basically the positive and expiratory pressure, so that alveoli is always having some air, it doesn't go totally empty. So if it goes empty, it can burst up. So light PEEP is being given, and proning is advised, breathing in the prone position. And why proning is given up, I've already explained that proning is basically advised so that your lower part of the lungs is more oxygenated. Heart and GID do not take air of your lower part of the lung and do not pressurize that lung, and so that your whole lung is breathing more. So that is there. And what more we can say is that proning is basically done because there is shape of the lung is conical. Okay, lower part is flat and upper part is having a tip. So basal area is basically having less oxygenation, and the disease is also affecting that the basal end. If you are lying prone, that basal part will expand better. The oxygen intake, the perfusion will be, means ventilation perfusion ratio over there will be better, because liquid or anything will go in the front part and lower part will have oxygenation more. So, but always proning is not the only thing which is always going to be helpful for everyone. Every person is different. So, in case if the proning is not suiting, vitals are not stabilized, then side lying is better than lying on your back. And next thing we have to take care is that hemodynamics should be maintained, and person is properly having ventilation, passive range of motion can be given, and positioning can be given, leg elevations can be given, and postural drainages techniques can be given in ICU in the person who are not awake. And we have to take care that who is going on the better side, who is going totally having negative direction, so that you can use the energy in the positive directions. We have to make decisions on based on that many times, and we have to treat each and every one according to their need. And we doctor can only decide on the spot, like, what is my priority. Okay, so then last I'll go for some take home messages, like what you have to do. First of all, remember, you have to breathe in and out daily, front breathing, side breathing, and lying on the prone breathing, keeping the two glasses on your back. Three types of breathing. Then you should start your day in a disciplined way. Do some yoga exercise. Minimum of 30 minutes of exercise a day is needed for you, and 15 minutes of breathing exercises are needed for you. Then you can go for a disciplined life, getting up on time, sleeping at time, eating time should be there. And you have to take care that you do exercises daily, and even your neighboring people do exercises daily, like your kid. Okay, you make them gameful exercise, you laugh daily, you go for some social activity daily. Although we are not going outside, always sitting at home makes you negative, so you should go for some 2 3 people calling daily. Okay, my friend circle, call them, just enjoy with them on the phone calls. And take water intake. Hot water is something we should everyone should take early in the morning and late in the night, 2 times a day daily. Or you can, even if you are having any symptom like cough, cold, or anything like that, go for steam inhalation daily. And go for hot water after every 2 hours. Sleep properly, eat healthy, having all the nutritious diet. And diet is also having very good role, like turmeric, ginger water, ginger tea is something very good. It has having good results. Turmeric capsules are having good results. And then we take intake of water, lot of water, drink properly. And then you should wash your hands at least 20 seconds a day. I mean, at a time, 20 seconds, like a happy birthday song. They say that till the time the song is playing, you should wash your hands. You should carry a sanitizer and mask with you. You should maintain at least 2 meters of distance. Social distancing is important. And what else? Physical activity, I've already told you. Then you can take check on your clinical features. If any kind of symptoms you are having, then go for quarantine or social isolation as per the thing detected. And motivation is important. Laugh, motivate others. Don't be angry, or don't just ignore people with COVID virus. All are human beings. Okay, so respect everyone and be cautious that you do not suffer from these diseases. And be positive, smile daily, think good things. Do not let your attention go to the negative side. Do not always creep, like, what is this is happening wrong, this is happening wrong. It's okay, whatever is happening, you have to live with it. You have to live with this virus now. Okay, virus environment. So how can you be happy? Just think of those things. Plan some day out of you. Plan something different. Today at home only we'll wear something which is not casual. Okay, today we'll have a party day. Today we'll plan out each and every behave like a party. Today behave like that. So just change your activities so that you are feeling happy. Okay, behave good with all the people nearby, respect others, and enjoy this life. I think I have taken a lot of your time. I hope it is giving you better side, making the COVID view in a better way. And in case if you have any questions or doubts, you can always do comments on this. I'll always answer back. And thank you for watching and being with me. There are a lot many requests and questions coming up. For general public, I'll just remember once more summarize that you have to go for breathing. One is lateral breathing, one is front breathing, one is breathing lying on your back abdomen, and at the back keep two glasses and move them up and in, down. Go for some balancing exercises like standing on one leg, stepping, go up and down in staircase, move. Walking is important, breathing is important. Yoga, especially alom vilom, is good. And meditation can be done. Breathing, feeling your lung. Okay, feel that my upper lung is, keep your hands upper lung, upper part of the lung is moving, just feel that. And middle lung, then lower lung, keep the hands so that your mind gets a biofeedback, I have to activate this area. and like that you activate your breathing. We can do this on your upper body, and meditation is taught for the legs and arms and as well. They say that you just think of your legs, that the oxygen is going over there. Think of your thighs, that oxygen is going over there. Like this, arms, legs, back, you can think eyes closed and feel that that part is moving and activating. You will feel that realization of the oxygen going out, and you will feel fresh while opening your eyes. And even rubbing your hands like this and keeping it over here, and then slowly opening the eyes and closing the eyes will also give you relaxation. Brahmari pranayam of yoga, that is like this. If you are covering this like this, eyes over here, and like this sound vibrations are basically giving your brain relaxation. Oxygen intake is increased. Like Brahmari pranayam is good. And what more exercises? Blowing a balloon, just balloon, spirometer, and you can take a straw and bubbling like water in the glass of in a glass, and just blowing a air like this, bubbles will be there. Blowing candles will be there. Any breathing exercise you should combine daily. In children, you can go for gaming and exercising, like catching the ball, standing on one leg, jumping, walking, running, so that they are more doing this exercises in a happy way. And exercises will increase your oxygen intake and will prevent the disease to flourish. So, and with this, I end up, and I hope you like this webinar and be in touch with me. Thank you so much for being there.